attending different meetings, I went to lectures about use of the laser in general. And then after a few different sessions with different types of lasers, I attended some of the programs about LAPIP and LAPIP. And since the market for treatment of failing or ailing implants has become so prevalent, I thought it was a very, very interesting idea to try and use the laser to help it save or treat problems with dental implants, and that was how I got into it. I had a young man that has a mouthful of implants. He virtually has one or two of his own natural teeth left, and he came to me, his dentist retired, and he came to me with a swollen palate, and he had a lot of pain and soreness, and he had invested a tremendous amount of money in his restoration with implants and crowns, and he really was facing losing his implants and redoing the entire case, and he was really ambivalent but very young and didn't want to wear a removable denture because at this point he still had fixed dental treatment. And so I said to him, well, since I have the laser, why don't we give it a try? And since it's such a new experience for me, I was a little skeptical, and I said, look, I can't promise you that this is going to be the answer, and we can do this, and I have seen good results, but I think you have to be willing to do this, and I am certainly willing to do this. So we decided we would try, and I actually did a full mouth, and he came back a week later and all of the inflammation had gone away. He was no longer having any discomfort whatsoever. It was really, truly remarkable. I think it's over a year, and he has his implants, and they're tight, and there is a lot of bone loss, but he no longer has this tremendous inflammation and discomfort and pain. So it's remarkable, I think. I don't think that you get sold on it until you really use it and you see what it can do. I have found it to be very beneficial, and I have only started using the laser in June of 2016, so I don't consider myself a really long-term user yet. And from what I've seen, I would highly recommend somebody really become familiar with and use the laser. I think it's an adjunct to all of your practice, and I think that it serves the dentist and the patient very well. The training for LAPIP was well organized and very thorough. We showed up in the morning and everything was available from breakfast to coffee breaks, number one, so that everybody, your comfort was important to the faculty and to the program from the Millennium. The books were very, very well done. Everything was laid out in a very organized and specific manner that you could use in the future for references, which I do. They also had other sheets or interesting sort of articles available that you took away with you to use when you were home. I thought the professors that taught us were very involved and very into this, which was great. In particular, Dr. Yuckna, who I very much respected in my periodontal life, and I felt if this was something that he was not only promoting but a big part of, that it was really worth my being involved with, and I thought he did a great job.